Dr. Zymantas, let's talk about teeth brushing. Should one use soft brushes, hard brushes, electric brushes, hand brushes, even in terms of floss? What should one use and how should one use it? Kind of like tell us.
Well, this is from a personal standpoint. I'm going to, I recommend for my patients to get a Braun Oral-B electric toothbrush. I believe it's the finest toothbrush out there. Supposedly the Sonicare toothbrush is an excellent brush as well. I just personally don't like it, the use of it. But if a patient, what I recommend my patients, especially the older patients who have possibly some periodontal disease or gum issues, 4 seconds, about 3 to 4 seconds on each surface of each tooth. So it roughly takes about 4 minutes, 3.5 to 4 minutes to do the entire mouth. If you pretty much have the bristles cleaning your teeth for 3 to 4 seconds on each surface at the gum line. You have to have the brush angled 45 degrees up into the gums to get into the space called the pocket. And if you do that very well once a day, that's pretty much all you really need to do. I recommend people to brush twice a day, once with an electric toothbrush and do a very, very thorough job. And then the second time they can just brush more or less to get major buildup off the teeth, the plaque, for say in the evening, and that's sufficient. Dental floss is very, very important as well because the bristles of the brush, especially as you get further back, cannot penetrate in between the teeth and disturb the plaque. So most periodontal disease begins in between the teeth because people do not disturb the plaque sufficiently, and dental floss is necessary. I personally also like a unwaxed thick floss because it's kind of like a bigger scrubbing brush that will get in between your teeth, and you've got to get down below the gum line into the pocket space as well. And if you see any bleeding, then you should spend a little bit more time in those areas, because those areas, anytime you have bleeding, it means you have an infection going on, and you want to make sure you disturb the area sufficiently of bacteria so that the site can begin to heal.
I see. So instead of backing off because you bleed, because on a normal wound you wouldn't start scratching if it's already bleeding. So here when it bleeds a little bit, you want to actually go and try to brush a little more.
Correct. If you get in there sufficiently and very well within, say, if you're doing a proper job and you don't have very deep pockets, within 2 weeks' time, if you have bleeding gums, your bleeding gums should stop bleeding because health will come back because the plaque is not there to create the reaction in the gums to start ulcers and cause periodontal disease.
Interesting. So let me ask you, should I be worried? I know that, number one, I brush, I think about 15% of the time my wife brushes, I shower, I shave, I do everything and she's still brushing. But rather than that, every so often when I let's say I don't floss for a couple, 2-3 days for whatever other lazy reasons I might have, I start bleeding a little bit when I floss again. Actually, sometimes it's like, wow, a fair amount, I think. But next day or the day after, it's gone again. Now, should I be worried? Or, rather than, of course, maybe increase my brushing and flossing a little bit, but am I already in bad shape if that happens or not? Or because it goes away, I'm still all right?
It's a little bit difficult to determine exactly, unfortunately, because sometimes you may have a deeper issue, but you're kind of clearing up the bacteria at the top of a pocket or in top of an infected area, and you can clean up that area a little bit better and make it heal. And if the pocket is deeper, though, bacteria that are deeper in the pocket can still be causing issues. So, of course, we highly recommend, if you have pretty much almost no dental issues, to be coming in on a regular basis, which is a regular basis we consider at least every 6 months for people that have healthy teeth and healthy gums. If you are compromised at all, then you need to be coming in more frequently to disturb bacteria in areas where it's not as accessible to people. Or if you personally know that you're not getting into areas effectively enough, you need to come in more frequently. Nevertheless, no matter how often you come in, if you do not do a fine job yourself over time, it will be detrimental and you will experience bone loss and possible tooth loss.
I got that. Well, my dentist tells me that, he says, Helmut, you have lots of saliva, which is basically very healthy, he says, and it's a very, very overall good sign. However, it has the side effect that I build up plaques more often, and so I'm supposed to see him every about 3 months, he says. Is that an occurrence which happens often, and is it a correct statement of my dentist?
That is true. So everybody's level of what's called mineralized calculus, which is kind of like rocks that grow on the roots of your teeth. And once the calculus, these rocks are growing on the roots of your teeth, then you cannot, as more or less like a lay person, you cannot get in there effectively enough and disturb this hard layer of what's called calculus. And everybody's biochemistry is a little different, and for some people they don't collect any calculus or any of these rocks on the roots of their teeth. Other people, within about 3 weeks after a sufficient and very thorough cleaning, they may already be building up calculus levels because of the oral biology in their mouth. And again, everybody is a totally different type of a person, and it's pretty much specific to each individual person and each individual patient.
Well, all right. So here we have it. Basically, again, listen to the doctor's orders and go with your own feeling, because it's true. We know, at least I do, and you indicated that there's this area or this area where, like, hell, I really can't get to it. So that's already right there an indication that, well, let the dentist clean it out every so often. Because a little bit more often than normally, otherwise you're compromising your bones, and that's not good.
Correct.
Thanks a lot. Bye-bye, Dr. Zymantas.